welcome. We're doing an interview today. This is Phil Harrington, the medical director of Sumis Medical Laser, and I'm speaking with Dr. Andy Hall of Sonora, California. So hi, Andy, and thanks for joining us today.
Hello, Dr. Phil. Thank you for having me.
So Dr. Andy is, there's a lot of doctors and people in the laser world that I've known for a long, long time. Dr. Andy is one of those, although I think we've only actually worked together in person once or maybe twice at a Parker, Las Vegas seminar. But
I think so. I know we had a meeting, I think, at my brother's office a long time ago, too. But I know that we've known each other a long time. You know, the interesting thing is I want to mention something. You know, I have talked with literally hundreds of doctors regarding laser therapy, and it's kind of like your first kiss, how you remember your first kiss. But the very first doctor who ever called me, he was this doctor in Iowa. And I remember him telling me that he had this background in physics and he was looking at lasers and he wanted my opinion on what I thought. And I gave him all these opinions and I told him that I really did my research before I got into lasers, and I was hoping that he would follow my advice and get a really good laser. And you know, the doctor got exactly the laser that I recommended, and you know who I'm talking about.
yeah, I think I do, Andy. I think I see him in the mirror every morning.
Yeah.
But yeah, I
Well,
appreciate that, and yeah, class 4 laser therapy has become my passion from what I see, what it does with
well,
people, improves quality of life.
well, I just want you to know how proud I am of you for you know, buying the right laser, using it in your practice with wonderful results, and ending up as the top class 4 laser expert in the world, in my opinion, and that's the opinion of thousands of doctors. And I just appreciate everything that you've done in the position that you're in now. And you know, you have always been very available to doctors, and you provide scientific based advice, and I know we all appreciate you very much. So
Well, I
I just
appreciate
want
that,
to
and I think it goes back to a word of advice that my dad gave me growing up, and he would just say, you know, tell the truth, and that way you only have to remember one story. So
that's right.
all I ever do is just tell the truth. So
That's
let's,
right.
Dr. Andy, let's move on to your story. Just wanted to get a little bit of a background about your chiropractic education, your practice, your use of laser. Can you fill us in on some of that background and history information?
Sure, I'd be happy to. I'm a 1975 graduate of Palmer College of Chiropractic, Davenport. Been in practice a long time. I was at a seminar in Reno, Nevada, way back when, and this is when the FDA had just was approving laser for use in the United States. And I had this little voice talking to me. It said, "You need to really pay attention to this. This is very important." As it happens, I had suffered a very severe disc problem. I had a 9 millimeter chunk of nucleus pulposus in my spinal cord. It was buried and it's sequestered. And for those of you who don't know what that means, it's like a jury when you set it apart. It had floated up, got behind the body of a vertebrae. I had talked to and been consulted with 5 different neurosurgeons. I was on the floor. It took me a month before I could even make it on a walker. Long story short, I decided I need to really look into this laser stuff. I got a good laser, and I had my staff use it on me. And in 5-6 weeks, I was totally pain free. And I was told by 5 neurosurgeons I would never work again. It was so bad, and I had it totally resolved thanks to the laser. As it happens, I also had the second class 4 laser in the entire Western United States. So I was very early in the laser stuff, and I had such wonderful results that I decided I really need to teach other doctors about this. Other doctors need to know. And I had patients come from 6 different states for laser therapy because I was the only one in the entire Western US that had a laser. And I remember talking with um, with K-Laser that we need more lasers out in the field. And I was asked if I'd be willing to credential doctors, of course, which I did. I was happy to.
Absolutely. Yeah. So that's it's a wonderful history in the U.S. in the last 17, 18 years, in the sense that class 4 therapy lasers were cleared by the FDA in December of 2003. And for several years, we faced a battle, whether it was from lower powered laser companies or from other sources, where um, people would say false things about class 4 therapeutic lasers. And there were many state boards of chiropractic examiners where we had to have a meeting with the board of examiners so they would realize that a class 4 therapy laser is within scope for a chiropractor to use, that it does deliver pain management, helping with inflammation, helping with tissue healing, and that it's non-ablative. I think we are pretty well over that hump of getting past that education and making people the awareness about class 4 laser therapy. There's still some pockets of objection to it. However, whenever we have an honest scientific discussion about the parameters involved with class 4 therapy laser and what it can do for the patient, then those objections melt away.
Right.
So let's move through. You're using the laser in your practice, and once again, you're in Sonora, California. Is that right?
Correct.
Okay. Is it beautiful where you live at all, or?
It is. I absolutely love it up here. I absolutely do. As a matter of fact, I live up on the ridge in Sugar Pine. I've got a gorgeous view of the Stanislaus River Canyon. I just love where I live. I feel blessed to be here. I really do. I just love it.
Excellent.
So,
Yeah. But then a few years ago, you had some bad news. You were diagnosed with idiopathic pulmonary fibrosis. Can you tell us some about that?
sure. 7 years ago, I developed a cough, and the cough got worse and worse. Got to where it was waking me up. I'd have coughing fits in the middle of the night, and I got thinking, well, maybe it's allergies. Maybe the pollen. There's always pollen up here in the mountains where I live, and I wasn't sure why the cough, and but it got worse and worse, and finally I decided, I need to go to the doctor. I need to find out what the heck is going on with me. This is getting serious. And my family doctor sent me to the pulmonologist, did a CT scan, pulmonary function test, and he sat down with me, looked me in the eye, and he said, well, you have idiopathic pulmonary fibrosis. I believe that it's probably due to 40 years of exposure to X-ray developing chemicals. We don't know. And if we did, it wouldn't be idiopathic. But he looked me in the eye and he said that my prognosis for you is you will be on oxygen in 4 years and you will be likely dead in 6. Well, this was 6 years ago.
Mm-hmm.
And I remember telling him, well, I have a very busy practice. I have a teaching schedule. I'm teaching laser therapy at conferences. And this dying stuff, I really don't have time for it. This is not going to work into my schedule, so we're going to have to figure something else out. And I know he cocked his head and looked at me like, well, this guy's in denial. But I wasn't in denial. It's like, we have to figure something else out. And so I decided I need to get back to my laser roots, and having taught laser, having known so many different things about laser, the increase in oxygenation, the healing, the power of the laser, all those things that the laser did, it just made sense to try laser. I did a search looking for any kind of research that was done on laser for pulmonary fibrosis, and there was zero. There was nothing. And I thought, well, I'm going to try this on myself. And if it works, if it helps, it helps. If it doesn't, it doesn't. But as it turns out, my cough had improved. I didn't wake up in the middle of the night coughing anymore. And subsequent pulmonary function tests had actually improved. And when I saw the pulmonologist again after the first one, he said, wow, your function test has actually improved. He says, I've never seen this in my entire career. This just doesn't happen. What happens with pulmonary fibrosis is you get worse and worse and then you die. I had another subsequent pulmonary function test after that. And I went back and I said, well, how did it look? And he says, well, your pulmonary function test improved yet again. I'm baffled. And I said, well, I'm using laser therapy. And he just kind of shrugged. He had no idea what that was. After the third or fourth visit with him, he sat me down. He says, I want you to tell me about this laser, because you keep mentioning this laser therapy. He says, the truth is, I don't have a clue what it is. And so we spent probably close to an hour talking about the photochemical processes that were taking place, why my oxygenation had improved, and why I was doing so well. And sadly, though, he said, well, I'm totally allopathic. I would never refer to some kind of alternative care. And I thought, well, that's too bad. I've got maybe a little bit of ethical and moral issues with that, but he's totally allopathic.
Yeah.
But he understands how it works. And what I did is I posted on this natural healing website regarding how I did with laser for my pulmonary fibrosis. And I had a number of pulmonary fibrosis patients get in touch with me asking for a referral to a doctor in their area, because I thought, well, maybe it's still just a fluke. Maybe I'm just lucky. Maybe who knows what. And after about 18 pulmonary fibrosis patients that all reported back to me how well they were doing, similar things as myself, increased oxygenation, improved objective changes on pulmonary function tests, I thought, someone has to do a study for this. And so I contacted the NIH. They were not interested. I contacted the American Lung Association. They were not interested. The Jewish National Hospital in Denver. I checked with all these people who were capable of doing research, but the truth is there's no money in laser. And it's not drug oriented, and nobody was interested. I thought, someone has to do a study. People are dying, tens of thousands of people every year, and I decided to do a study myself. And so I began a study for pulmonary fibrosis using laser therapy.
Okay, so what I want to do for the people watching this that are not aware of pulmonary fibrosis, just let me take a few minutes. I want to share some facts and figures about it. What we're talking about is idiopathic pulmonary fibrosis, the abbreviation IPF. It's a rare, very serious lung disorder. It causes a buildup of scar tissue in the lungs, which makes the lungs very stiff. To the point where they are unable to expand and contract. That makes it very, very hard to breathe because the lungs are not flexible. They are unable to take in as much oxygen as the lungs need. And of course, in the lungs is where you're getting that exchange from the oxygen across the bloodstream to get that oxygen carried through the arteries to your body to stay healthy and alive. So with pulmonary fibrosis, we're getting scarring on the walls of the air sacs within the lungs. And as this builds up, it gets more difficult for that oxygen exchange to happen and leads to respiratory failure. So a couple of the statistics associated with the condition, although it is fairly rare, there are about 100,000 people in the United States who have IPF, and there's about 30 to 40,000 new cases every year. Worldwide, the statistics are that IPF affects around 13 to 20 out of every 100,000 people. And the information goes on further to say that it's difficult to pinpoint who will get IPF, but there are indicators show that men are more likely to get it than women. However, another predictive factor is age, but the numbers, men and women split, it is about even, maybe just a few more men. The condition is difficult to diagnose because there are few, if any, symptoms in the early stages. And I think early on, Andy, you said you had a cough. Could
Right.
you remember how long did you have that cough before you decided to seek medical care?
It started about a year prior to initiating medical care, and it got worse and worse, and I had no idea why. But it got so severe that I really thought I really need to go see what's going on with me. The other thing is that I'm a very, very active guy, and I remember swimming out to my boat that was moored in the local lake, and it was probably 70 yards out there. So this is the same lake I did the mile swim as a Boy Scout, got my merit badge. And about halfway to the boat, I was totally out of breath, and really I had visions of drowning out there. Fortunately, there was another boat moored close to where I was when I just ran out of gas, and I actually borrowed a life vest and rested for about 15 minutes before I could make it to my boat. And that was really what initiated the trip to the doctor. I just thought, I could have drowned out there,
Mm-hmm.
and that should have been a piece of cake
Yeah.
swim for me. But I couldn't make it to my boat, and so that's what prompted me to go.
Okay.
But
And
I can tell with your statistics, as usual, Dr. Phil, you have done your homework on this stuff.
well, I just want to make sure, we're going to have people watching this. We may have doctors who are either currently using class 4 laser or are looking at getting class 4 therapy laser to use to treat patients for IPF. But we're probably also going to have people who have IPF themselves or are trying to decide if they have IPF, or may have friends or family members. So I wanted to give some of that background information because from the reading that I did, the symptoms of IPF, and they go on to be a dry hacking cough, shortness of breath, chest discomfort, those symptoms mimic other conditions, and it makes that diagnosis of IPF very difficult. Now, let me ask you, in your own experience or in seeing others, other symptoms mentioned include clubbing of the fingertips, where the fingertips and nails are enlarged and rounded. Okay, so Andy, you have
Yes,
that, and in
I
your
do.
treating other patients, do you see that? How often do you see clubbing of the fingertips?
That's very, very common, extremely common with pulmonary fibrosis patients.
Okay.
The other thing is there's a lot of muscle and joint aches also. So there's actually a lot of symptoms that go along with it, but the clubbing of the fingers and the toes, very common. So that's one of the first things that my pulmonologist looked at is my fingers and my toes, and sure enough, that's exactly what I have going on. So
Okay.
now I wish that I could tell you that laser therapy for IPF was a cure. It's not a cure. And the reason I say that is with the study that I'm doing, of course, I have these patients after initiation of laser therapy. I see they send me copies of their pulmonary function test results and also subsequent CT scans. What I'm not seeing is a reduction of the fibrous tissue. However, I'm not seeing an increase in fibrous tissue except for just one patient, and the increase was very minimal. So I think what we're seeing is an arrest of additional fibrous tissue, mostly because of the reduction of the inflammation in the lungs with the laser therapy.
I'm really glad that you added that point, because that's a key point, and we have to tell it like it is, and we have to tell the truth, and we can't give anyone false hope. There's no point in giving anyone false hope.
Absolutely, absolutely. It is not a cure, but it's a very viable way to manage the disease. And the wonderful thing about it is there's no side effects. There happens to be two anti-fibrotic drugs on the market. One is Ofev and one is Esbriet. They both have terrible side effects. They are both extremely expensive. I know when my pulmonologist prescribed Esbriet, this was before Ofev was even on the market. I checked and it was $9,000 a month, and my insurance wouldn't cover it. And it was like, well, that's not going to work for me. But the antifibrotics, it's not a cure either. What it does is it slows down the deposition of more fibrous tissue in the lungs. But the problem is so many IPF patients can't take either one of them because of the severity of the side effects. The other thing is that not all patients respond to it either. So, I don't take either one. I don't need to. I'm still doing extremely well. And here I am 6 years after diagnosis. And actually, according to the original prognosis, I'm supposed to be dead this month. And yet my oxygen levels are still in the mid to upper 90s. I'm not even close to needing oxygen yet. And it's all due to laser therapy. So I just feel strongly that patients with IPF really need to see a doctor with a class 4 laser, and even all class 4 lasers are not the same. I feel very strongly about which lasers are used for this condition, as I found that especially class 3 lasers, they have not been helpful for patients at all.
Okay,
Uh,
so
so,
what we'll do here, Dr. Andy, is we'll take a little bit of a break. And when
okay.
we come back, what we'll do is we'll talk more about your use of lasers and the laser protocol that you're using, and we'll continue the discussion. All right, welcome back, everybody. This is Dr. Phil Harrington with Dr. Andy Hall, and we're discussing the use of class 4 laser therapy for idiopathic pulmonary fibrosis. In the first segment, we talked about Dr. Andy's history as a chiropractor and his unfortunate diagnosis with idiopathic pulmonary fibrosis 6 years ago. He shared his story about using laser to treat patients. We also shared some of the statistics and signs and symptoms associated with IPF. And we started to talk some about Dr. Andy's experience and use of laser to treat the symptoms associated with IPF. And one important point that he made that I want to reemphasize is that we are not claiming that class 4 laser therapy will cure IPF. It will not, and we are not going to claim that. However, what Dr. Andy has seen in his experience and in the experience of patients that he's spoken with around the world is that it seems to arrest the development, that it seems to stop the progression of the growth of scar tissue in the lungs, which I think is a very important point. So, Andy, let's pick up where we were. You were talking some about the use of laser, and maybe you could talk some about the typical laser protocol, how many visits, things like that.
Sure. With our protocol, uh, the way we schedule patients is we have them get treated with the laser 3 times a week for 4 weeks, twice a week for 4 weeks, and then weekly, really for the rest of their life. I continue to get treated with laser on a weekly basis, and I do really well. With this COVID-19 pandemic, a lot of the IPF patients have not been able to go get laser. And what we're seeing, I think, what are we on day 44 of the shutdown? And I have had a great number of patients say, gosh, I haven't been getting laser and my oxygen levels are dropping. I'm running out of gas. And a lot of those patients that are at least in communities where the risk is low, it's like, you need to probably resume your laser treatment. And I'm just hearing this a lot. So, uh, maintenance for me has worked great. Like I say, my oxygen levels are still up, and my energy is up. I'm doing great with it. Again, I nearly every day I am being asked to refer these patients to doctors. I mean, really all over the world, and it requires a good laser. And this is why I suggest Sumis lasers to so many people. Even today, I recommended a Sumis, and the reason why, there's several reasons. Number one, you have great power. We recommend a minimum of 10 watts of power. The other thing is there's the wavelengths that are being used in the laser are also very important. Um, and of course, with Sumas, one of the wavelengths is 915 nanometer, and this is one of the things that really enhances the oxygen delivery. Um, our lungs are compromised, and what healthy lung tissue we have left, we have to maximize the potential for that. And so the wavelengths with the Sumis lasers are absolutely ideal, and they are scientific based. So that's
So
what we
let me
want
just,
them
yeah,
to
let
do.
me just take a second to give a little summary, and maybe sometimes you don't want me to get started talking about laser because could talk about it all day, but just real quick, a class 4 laser, it's higher in power. With the
Okay.
lungs or other conditions deep inside of the body, higher power, just like with the light bulb, higher power is a brighter light. So a class 4 laser, it's not to say that lasers are good or bad. It doesn't benefit anyone to have that discussion. It's more a matter of the proper scientific parameters that we need. And that first parameter of power, the brightness of the laser light, in order to get enough light deep in to the tissues. And the second one that you said is the wavelength. It is the infrared wavelengths. In our equipment, we are using wavelengths of 810, 915, and 970 nanometers in the infrared. Those infrared wavelengths penetrate deep into the tissues, so you can get direct absorption. You have different components in the cells, in the tissues, that are absorbing photons of light. And you need to have those photons getting absorbed in order to get the benefits of laser. So yes, I think in general, any one seeking treatment for IPF, you need to find a doctor with a class 4 therapy laser. It's just so important.
Absolutely. And here's the other thing is that the wavelength is important. Power is important, but also the modulation capability of the laser. And not all class 4 lasers are capable of dialing in the modulation to the correct hertz. And so the protocol that we have is set up, and it's based on a Sumis laser, frankly. So any doctors who are looking for lasers, uh, I really want you to do your homework. And if you're looking at a laser, I want you to ask, can you dial in, for example, on our protocol, um, lung and bronchi, 727 hertz. Is the laser you're looking at capable of doing that? Because that's part of our protocol. The other thing is difficult healing, 17,024. Can your laser do that? If you're going to buy a laser, get a good
Okay,
laser.
so
You are looking for a laser, or they want to trade up to a good laser. you need to look at Sumis laser. Really, as far as I'm concerned, just like I told this doctor who contacted me just this last week, he's got platinum 4s. And I told him, you've got the best lasers on the planet. You can't get a better laser than that. And I just feel very strongly that if you're going to get a good laser. And it's not only for yourself, but do it for your patients. Your patients, your patients
Absolutely.
deserve it.
Absolutely, yes. Okay, so let's assume that that our doctor does have a good quality class 4 therapy laser, and they're going to start treating patients that do have IPF. Now, a pulmonologist is going to have all of the necessary diagnostic and testing equipment. What sort of things would a doctor have in their office that's using a laser? Is using a pulse oximeter that goes on the fingertip, is that sufficient to measure? Or can you tell us about some of the things that you have in your office to measure
Well,
function?
sure. It's great to have some kind of something objective in the doctor's office to monitor. It's great to listen to the patient and say, gosh, uh, I could only walk for 6 minutes before, running out of breath. I had to stop and catch my breath. And now I can walk half an hour or an hour. And we hear this type of thing all the time. But those are all subjective. And it's really nice to have some kind of an objective thing so that the doctor can keep track, and a pulsometer that you can check with the patient and just monitor that in an objective way, and the doctors will be shocked at how the oxygenation is improved. And again, IPF, if you talk to the medical profession, you talk to the pulmonologist, they will always tell you this is not a condition that ever gets better. This is a condition that you just get worse and worse and you die. But yet with laser therapy, we see improvement in this condition. Again, it's not a cure, but it's an improvement. And as opposed to some of the drugs that don't increase your oxygenation, they've got horrible, terrible side effects. Um, I just think an IPF patient is crazy not to look into laser therapy.
So I'm
I,
curious, Dr. Andy, at the beginning of your care, do you remember what were your pulse ox numbers? Do you remember what your blood oxygen levels were?
I I really don't know. My initial ones, I think it was probably down in the lower 90s though.
Hmm.
And then as soon as I started using laser therapy, they just came up. It ran just 97. It still runs about 97.
Okay.
This is extremely good. I know that last year I went into the pulmonologist and they checked me. It was actually 100.
Okay.
And the funny thing is, I asked the nurse. I said, "Well, how's my oxygen today?" And she says it's 100. And when the doctor came in, I already knew what the answer was, but I asked him. I said, "Well, what was my oxygen level today?" And he looked at me, 100. And he just, I don't know. I just expect him to think I'm just going to decay and
Yeah.
die.
Yeah.
That's what he expects. But I mean, it was exceptional. And we're talking a guy who was at that time 5 years after diagnosis.
Hmm.
So oxygen levels have been wonderful. And again, it's just due to laser therapy. I'm not doing any meds.
And then just to review your standard protocol, I think you said it's 4 times a week for 3 weeks,
No,
or
it's 3 times a week for 4 weeks.
okay.
Then we go to twice a week for 4 weeks, and then
Okay.
weekly thereafter.
Okay, all right. And then are you treating anterior lung fields, posterior lung fields, or doing both, or how about
We're
that?
doing both, and what we're doing is we are trying to stay between the ribs. The laser, a good class 4 laser will pass through the rib bone as well, but we really want to bypass the ribs and just get through the intercostalis muscles and through the pleura and get as much of the energy as deep into the target tissue as possible, which is, of course is the lungs. And so we do that on the front, and we also do that on the back.
And then you have the patient seated on the table?
Yes, we just seat the patient on the table
And do you have
with
them
the
do any breathing exercises during treatment, or do you have them do anything actively during the treatment?
no, no, they're just static. I just want them to stay nice and relaxed. With women, we have them keep a bra on, and when we get to the front in the breast area, we just have them cup a breast and hold their breast up, and we'll get up underneath the breast area. Doing the back on a woman, I do unhook the bra to kind of get it out of the way. We want our women patients to feel comfortable. I want to feel comfortable, and the same with all the other doctors. We want our patients to be comfortable. Of course, with men patients, it's a non-issue, but that just seems to work really, really well.
Okay, and you mentioned this a little bit earlier, but you had such good results in treating IPF that you did start a study, and you have a study website, and we'll make sure that we get the link in the in description of this video. And just to give ballpark numbers on, could you give an estimate of how many patients would you estimate have been treated with class 4 laser therapy and their response?
I have referred probably getting close to 350 pulmonary fibrosis patients to providers, mostly through the United States, but also in the UK and all over the world. So of all the ones that I've heard back from, obviously they have not all enrolled in my study. I've probably got 50 or so enrolled in the study. But of all the ones that I've heard back from, there have been maybe 3, maybe 4 patients that really claim that they have not had any subjective or objective positive change.
Mm-hmm.
But when you look at the numbers with that, it's astounding.
Mm-hmm.
So we have had wonderful success with a huge number of IPF patients.
So, and just to stress the point again that with laser, we are not claiming a cure. And then also we're not claiming that it's going to help 100% of the patients.
That's
But
right.
with our laser treatments, our laser treatments are non-invasive. We're not cutting the skin. We're using non-ionizing laser light, so we're not causing any damage. And we have that potential to help with healing of the body internally. And I did not pull up the sheet to describe all of the potential side effects of the prescription drugs that you mentioned. However, as with any prescription drug, you've got a whole, long column, a long list of side effects associated with those prescription drugs. Whereas with laser, therapeutic, class 4, infrared laser, there's really no side effects.
That's true. And some patients too choose to do both. And I have absolutely no problem with that. I am for anything that's going to make an IPF patient stable or improve. So I'm certainly not against the meds. If they can tolerate taking it and they can afford it, then that's fine. I know last week I had a patient from back east someplace, and she mentioned that she was prescribed OFEV, and her copay was about $2,100 a month.
Ouch.
That's the copay, and she can afford it, and that's great. I'm happy that she can afford it, but I'm afraid that she's not going to do well with the side effects, which is a lot of diarrhea and gastrointestinal issues and that type of thing. Esbriet is one of those that you are very sensitive to ultraviolet light. If you get outside, you're outside for more than 10 minutes and in the sun, you have a raging sunburn. But yet that is due to ultraviolet light, not red or infrared that we use with laser. And so there's no reaction to laser for the patients on Esbriet. That's
Okay,
the good news.
so we spent a fair amount of time talking about class 4 laser therapy for idiopathic pulmonary fibrosis. We're going to have information links in the video here, and I think we've done a good round discussion of your story, Dr. Andy, from your diagnosis of IPF through deciding to self-treat, and your story, and then moving through treatments for IPF. So if anyone has follow-up questions, we'll have contact information in the video that people can ask follow-up questions about treating IPF. We just got a few minutes left here. I wanted to spend just a little bit of time talking about, in the world today, we have this viral infection that causes an overwhelming inflammatory cascade in the lungs and causes severe respiratory problems. The COVID-19 situation and COVID-19 infections. What are your thoughts there?
Well, I believe we're going to see wonderful success using laser for COVID-19. About 3 weeks ago, I was contacted by Dr. Stephen Brabas in London, and he asked if I would be interested in joining a working group of international doctors developing protocol for treating COVID-19. And of course, I was thrilled, flattered to be able to do that. I was the only American invited to join this working group, and the reason why I really thought they would ask you, Dr. Phil. You're the top class 4 guy in the world, but they asked me, and the reason why is because of our work with lung patients, and they checked out our treatment protocol. One of the aspects of our protocol was for chronic lung issues and that type of thing. So we had to kind of tweak a little bit for acute. But we also reviewed how to apply the laser intracostally through the chest and the back. And at present, we're doing a study in northeast Italy for a moment.
Okay.
Yeah, so they're doing a study in northeast Italy on 15 hospitalized COVID-19 patients, and then there's a control group of another 19 patients. And the study should conclude in probably another week, 2 weeks at the most. And as the great thing about laser is it stops replication of viruses. And so, we expect wonderful results with this study. The great thing, not only does it stop replication, but when you're lasering the lungs, because of the vascularity, we're having the red blood cells go throughout the body. So it's systemic. The other thing is the very well-known anti-inflammatory properties of laser, the anti-edema properties of laser. We would all be shocked if we just don't see wonderful, wonderful results from this study. Once the study is completed and it turns out as we all expect, then what they will do is they're going to start using laser therapy all throughout Europe, many, many countries in Europe, and they have multiple sites already set up in the UK. When we were doing this study, I was asked, how are you guys set up in the United States? You guys ready to go using laser in a hospital setting in the US? And I told them, honestly, and Dr. Phil, you may know about this much better than I do, but I know of only 2 hospitals in the entire country that have lasers, and one is Mass General in Boston, and the other one is Stanford. You might know a lot more about that than me, but I hate to be skeptical, but I think that we have a medical politic problem in this country, and
Right.
I hope I'm proven wrong, but I am a bit skeptical that we'll see this happen here. I would love to see it because the COVID-19 patients, they deserve it. The great thing is that you are stopping replication. And I think that also what we're going to find with laser for COVID-19 patients is the lack of sequelae after they recover from the virus, that they may not get pulmonary fibrosis or some other scarring or some kind of long-term residuals from the virus. I really think that the laser will stop that from happening. And I think that the American public deserves to have this done. We still can't jump the gun. We have to wait and see how this study goes.
Right.
But I really think that we're going to see wonderful things with this study. And it's exciting to see that this is going to be used throughout Europe and in the UK. It's very exciting to me.
Yeah, so I just wanted to double check my calendar. We're recording this on April 29th, 2020. And that's what we're saying here today. And, you know, maybe 2 weeks, 2 months, 2 years down the road, I think we can pretty well be guaranteed we'll be saying something significantly different. How different it is, who knows? I agree with you. There can be a certain amount of politics that goes into the use of laser. You know, and we've seen that time and time again, whether it comes to using laser for musculoskeletal injuries in the hospital setting or for a wound healing, post-surgical healing in the hospital setting, and then now for lung conditions. And I think that the message that both you and I have given today, and I'll stress it again, we're not claiming a cure. We're not claiming it's going to help 100% of the people. However, we can say that there are very sound scientific mechanisms that show that laser therapy has that potential to help these various conditions. We have a pretty significant body of patients, a number of patients who have been treated and have had successful results. And we know we know that we are not doing any harm. We know that there are no harmful side effects. So, you know, speaking from that standpoint, you're right. It is something that individual patients do need to know about class 4 laser therapy. Doctors who care about treating patients with these conditions do need to know about class 4 laser therapy. So I'm just so grateful for you, Dr. Andy, with the work that you did. And whatever phrase that you want to use, you know, we've all have various hurdles that we encounter in life. And when something happens, it's how we react to it. It's not the event that happens. Dr. Andy, I am so empathetic, and I really feel bad that you were diagnosed with idiopathic pulmonary fibrosis, but look what you've done with it. And I just want you to, I hope you get the accolades that you deserve, because you have improved the quality of life of hundreds of people around the world as of today. And that's only going to expand and mushroom. There's going to be thousands and then tens of thousands of people around the world who have gotten a better quality of life because of what you've done. And that's a
Thank you, Dr. Phil. I'll tell you though, I am not looking for accolades. I just want to see you know, patients who have their lives expanded and more quality of life that they're experiencing now. My goal is to die of old age. You know, there's a bunch of Westie dogs that they have this hereditary factor for IPF, and they are getting laser, and guess what? These dogs are dying of old age. They're not dying of IPF.
Yeah.
That's my goal. I want to die of old age.
Okay.
So
all right. Well, I tell you what.
You know what the acronym is for light. So we're looking at laser light. LIGHT. That's letting in God's healing touch.
Excellent. I like that. That's an excellent thought for us to close on. We've had a fantastic conversation here, Dr. Andy. I really appreciate your time. We'll share this with as many people as possible, and we're probably going to have follow-up questions, and so maybe we'll do another interview further down the road. But for now, I appreciate you sharing your story, your use of class 4 therapy laser, and how you've been able to help patients, and it's just been a real pleasure.
Well, it's been a pleasure talking with you, Dr. Phil. It's great to see you again.